Good afternoon, everyone. Thank you for being here. We'll go through the data, then talk about some of the strategies as we move forward in this new phase. In the first wave of this pandemic, you could reference that I know somebody who had COVID, or I heard of somebody who had COVID. Now you can say I know somebody who died of COVID, or I know somebody's family member who died of COVID. And that's where we are. The loss of life continues in our community. We've lost 4 members of the community over the last 24 hours. We've lost 20 community members since Friday. We had 1 hospital death, a female in her 70s, and we had 3 residents of nursing homes pass. So certainly it has just been a brutal week, to say the least, and we want to just continue to think of these families who aren't able to be with their loved ones as they pass, and keep them in our thoughts and prayers. Our 7-day rolling average, 6.9%. We now have 274 people in the hospital, with 31 individuals who are well enough to leave the hospital, but haven't been able to essentially test negative for the virus yet. So we have a plan in front of the state. I believe we'll get a decision on that plan in short order this week. That would mean that those 31 people could immediately go to this different facility, which would drop down our hospital capacity, create about 11% hospital capacity right away. Overall hospital capacity, again, even though we've had COVID numbers slightly increasing, when you look at our overall hospital numbers, I get them every day, we're in the same range. So we're give or take a couple beds either, or sometimes we'll go down a couple, sometimes we'll go up a couple. That's pretty much depending on what other health needs there are in the community. So we're still in the same range when we look at the capacity overall as a community. I know that's going to be a focus of where we are in the pandemic as we look at our ability to treat our sick, and that will drive regulations as far as commercial regulations, which certainly this wave of the pandemic is so different from the beginning, where commercial regulations were more effective, but less effective now because the virus spreads indoors, and folks are having more gatherings indoors, and some of the obvious industries that drive cases in the summertime now are under severe regulations too. So many of them aren't even open to be able to potentially have more spread there. Overall, 14,984 cases since the beginning of the pandemic on March 16th for Onondaga County. 288 new cases, so that's down about 112 from yesterday. Again, we'll see if this is an outlier. It seems like every week we have one day that's the low day and one day that's the high day. We'll see. Certainly the last 3 days were the 400 case range. You could see more of a steady uptick from Thanksgiving there. It looks like maybe we'll get a couple slower days, but then we go back into the gathering schedule, and we can talk about that. And I know Dr. Gupta will have some thoughts on that. She can share some of the examples that she's seeing in the community in our investigations that are behavior that's very normal in normal times, but it's behavior that can get you sick or worse in the 100-year pandemic. Looking at number of cases, who have they impacted? 8,049 female, 6,862 male. Under 19 years, we have 2,351 cases. In our 20s, 3,178. In our 30s, 2,155. In our 40s, 1,800. 50s, 2,106. 60s, 1,540. 894 cases in our 70s. 611 in our 80s, and 349 in our 90s. We have beefed up symptomatic testing. When you look at what we're doing at the F-Shed during the week, again, if you're sick, if you've had an exposure, direct exposure to COVID, you need a symptomatic test. Go to ongov.net/Cayuga Medical. We now have, I think, over 600 slots a day there. So that's good, Monday through Friday, 9 to 1. This past weekend, we started our symptomatic weekend testing. Again, that was the 12th. This weekend, we'll be doing it on the 19th as well. But in Essentia Health, 1050 West Genesee Street, they were booked. So high demand there. So we've beefed up the symptomatic testing. We're still doing the asymptomatic testing here at the On Center. You can go and pre-register. We've increased capacity there. Again, that's covid19.ongov.net. This is an asymptomatic rapid test for those who are not having symptoms. What we like about this is that we're finding positives in the community with people who don't have symptoms. And so we would never know where to look for them. And because of that, we are able to prevent spread and I think save lives. Looking at community testing this week, let's go through this. We're not only doing it here in the On Center and in the schools, we're going out into the community to try to hunt down these cases. Tomorrow, the 15th, Solvay Fire Department, East Syracuse Village Hall, in the Clay Senior Center. Wednesday, the Fayetteville Senior Center. Thursday, Shove Park and Camillus. And in Baldwinsville, the Canton Woods Senior Center. Friday, we will be back at Salina Town Hall and Onondaga Town Hall. Just a reminder, walk-ups are not allowed. We need you to pre-register at covid19.ongov.net so this can happen. Some positive news, and then we'll go through some of our strategy moving forward. Positive news is we expect frontline health workers to receive the vaccine midweek this week in Onondaga County. And I'll have a call today at 4 to go through with our nursing homes their plans. Looks like nursing homes could be the end of this week or the beginning of next week, but we're going to talk about hopefully the participation rate will be close to 100%. If you look at our hospitalizations, 29% of our hospitalizations are driven from nursing homes, and you look at again, when you look at the percentage overall of active cases, it's not near 29%. So it shows you how at risk that population is when they get COVID to get into the hospital. So this is just really great news. It's that this population is going to be vaccinated. And then as we get through that, the Pfizer vaccine is the first vaccine, followed up by Moderna, and then the same people took Pfizer shot 1, well, it takes shot 2, but it looks like we'll be able to get into the phase 2 of the vaccination plan potentially in our county, and we'll go through that a little bit more, and I know Dr. Gupta can touch on what I miss. Looking at where we are and what our strategy is, I know that when you're in this spot, it's very difficult because you want to do something. You feel anxious. We've gotten beaten up. Last week was probably the darkest week our county's had, at least since I've been in public service. But you have to do things that are effective and efficient and that are meaningful, and you have to use the data, and you need to find balance. And so what we've done that has worked well to this point is we've identified the virus, we've isolated the virus, we box it in so that we limit the spread, trying to get that RT factor, the rate of transmission, below 1%. So if we have 400 cases tomorrow, that doesn't mean that they're giving it to 400 new people. That means they're giving to 400 cases means they're giving to less than 400. And then that is going less and less. That's how we have success again. And then we identify, isolate, and now we're talking about vaccinating. We're talking about essentially the cure for a lot of people. So how do we get here with what will be certainly the choppy and most painful weeks of the pandemic moving forward? We need to continue to identify. We'll now be doing over 21,000 tests a week in Onondaga County. moving forward, trying to identify this. This is not just this is in addition to the hospitals and other testing sites. These are county-driven programs. So we're going to continue to work to identify the virus every which way we can. The biggest challenge of late from the two surges of Halloween and Thanksgiving is to isolate and then box in. If you look at other countries, you look at our own success in the first wave, you look at other countries like South Korea, who've had a lot of success, they were able to isolate, box in the virus in 24 hours. That's where we need to be. Our team worked this morning thoroughly. We've identified our workforce, union reps, and we will be offering jobs to those who have been furloughed to come back and do investigations. We will put 225 people to help get us to that 24-hour turn time period again. So that will be a huge surge. There's a little bit of logistics to that. Your senior investigator is faster than your investigator who's doing it for a first time, but by the end of the week we expect to be a well-oiled machine. And then we're starting to prepare and plan heavily with the health department and the emergency management department in my office related to the vaccination. The vaccination, there's really three different critical components. One is the implementation. That's probably the easiest. Those are who is going to actually give the shot. There's only certain people that can give the shot. I can't give the shot. The second is certainly the logistics of it, location, security, distribution. We have a great logistics company here locally, Mohawk Global. They've agreed to help us with that component of this and offer consultation with that. And the third is communication, and the communication is going to be very challenging. You're looking at communicating to the public the various phases of when people can get shots, when the shot and the vaccine's available. You're looking at communicating with people to make sure that they believe the shot will be safe. And that is something. You're then looking at kind of a logistics but communication piece of pre-registration. This will be a massive campaign to do this and put this together. Because for us to be successful, we need 75 to 80% participation in our county. That's 346,000 to 370,000 people. So the end of the pandemic will be certainly probably the most meaningful part of it, but it's going to be a lot of work. So that's where we are. Those are the three strategies, and we've felt the surge. We're now surging back so that we can get these caseloads under control and that we can prepare ourselves to have a successful vaccination distribution strategy moving forward. Dr. Gupta wants to come up and talk about a couple things. So, Doctor, please join us.
Good afternoon. Thank you. I just wanted to go over a few points, actually, 5 areas I want to touch today. Is number one, starting with the cases. As you all know, our cases continue to rise exponentially. I am not using that word lightly. Exponentially means really, when you look at the curve, the graph at our website, you might have seen. And I kind of try to take a screenshot of that, and I think you should go into the dashboard. And what it shows to you since the beginning of the pandemic, how the cases continue to rise, and then what we saw somewhere late October, November, I don't think you can see that. It's not a good way. If I had a PowerPoint, I could show it to you. Then it just goes up sky high, essentially, for the lack of the better word. Putting in a numbers perspective, so from in October 15 to November 15th, somewhere in that, we have 2,552 cases in between November 15 and December 14th. They escalated to 7,799. It's about over 200% increase. That tells you a story, which county executive just mentioned, that after when we saw that, the holiday sort of a mode, people have that in their mind, starting with prior to Thanksgiving with the Halloween, and then you add Thanksgiving on top of it, that created further problem, and then you continue to see staggering exponential growth in a logarithmic way that we saw the cases at this point, which are becoming quite a bit of a difficult situation for us. And what happens then, it results in increased hospitalizations. And when you have increased hospitalization, that will lead to more critical care patients. They are on ventilators, and we have seen unfortunate event of loss of life. And that's what is quite a bit of a bothersome to me, as I see as a physician, as a commissioner, that there are things are happening. You can go into trajectory which is straightforward. In an ideal world, that will be great, that everybody follows all the public health guidance. But when you start to see people go towards to the other side, that creates the problem, and then that's how we see the things fall apart. I would ask, the thing is, so for example, why does it happen? Those people who are hesitant to wear masks, when they started to consider they are going to see their friends and family they haven't seen, or I got this test done today and I'm fine, but that's how it did not happen, what we are seeing during the case investigation. I would ask those who are hesitant to refuse to wear masks, if you're wearing face covering and following physical distancing and staying home when sick, or not having get together, as we have continued to talk about that, at least for now, even with the vaccine that will continue, you literally can save at least one person's life, maybe. It may not be immediately you, but that's something you may have seen a third person, second person, third person that will impact. This is in fact, usually younger people recover fine, but the person who may be related to you has in contact with you, and 2 or 3 connections down the road may not recover and end up dying. Is that fair? It's not fair. It's not fair to those families who have to deal with the loss, and they have to tell their child or to their grandparents that they will have to look at the empty seat, and they could have prevented it, hopefully. That's what I'm asking people to think about at this point. Number 2, case investigations. So case investigations have been, as you know, as a county health department, we have been at the forefront of it, and our county executive have been so much supportive of all these things, putting all the rest of the county workforce to help and support, which is, I don't know how many other county executive has done, but certainly I am in the best place, I would say that. It does make our lives relatively easier, but it seems like it's not enough at this point. So I'm here to remind people, as soon as you get the test results, please immediately isolate. We will get to you when we get the test results. It may take 24, 48 hours, depending on when we get the results, how many people we have. So it means you started to look how many people you might have been in contact 2 days prior to onset of your symptom, or 2 days prior to your date of test if you're asymptomatic, and make a list of it and inform them in good faith, because you will save lives. You will avoid transmission of virus within your family and friends and workplace. Help us, please, to reduce the transmission and help us save the community. Number 3 item, quarantine. As you saw, CDC has come out with the 2 options. One is 7 days test out strategy, and the other one is 10-day no test. However, we work under New York State Department of Health jurisdiction. This is not adapted by Department of Health at this point. many of our local health departments have requested state to review that, and they are looking into it at this point. The principle of sanitary code and public health law is you can be more restrictive than the state, but you cannot be less restrictive than the state. The other part is if the state did not have a policy, we could have immediately adopt this policy. In one situation, we did adopt the policy as soon as it came out from the CDC, before state actually did, was when they started with the onset of symptoms. 2 days prior to the onset of symptoms, you should count that this is a period of exposure. Before state adopted, we locally adopted it because this was more restrictive. So just to give you an example, essentially, that's how we are. I know we have gotten several calls and people are wondering that how come you cannot do that. It's a work in progress. We are asking people to be patient. When the state does, certainly we'll go. Number 4, testing. So there is so much increased testing in our community, and thanks to the county executive's leadership, who has done tremendous work throughout and continue to do so. What we started to see some pattern that people are getting tested in one place, they don't like the test result, positive, they go and get tested someplace else. They feel like it's going to be negative. It does not help. I'm asking, please don't do that, because you're wasting a resource. It does not help anyone. So if you're a positive, you are positive, period. That's how it goes. The fifth and last but not the least is vaccination. County executive has addressed that. I'm just going to go a little bit into a little bit more specific about, as you know, the first priority is the healthcare workers, which will happen, and nursing homes. That will be with the help of the pharmacies. What is the role of local health department? That's what you often ask. That's what we ask. We are working with the State Department of Health to identify the ways we will be responsible for our community. That will be in mass vaccination clinics, how that will roll out. This is something discussion is happening. Right now, the quantity of vaccines are not that high anyways, so our role will be a little bit later. So we will continue to inform you as it happens. The good part of all this is the logistically, there's so much infrastructure is built because of testing, that we can roll it out and build on it, essentially. So we as a local health department will be responsible for registration, making sure that people are going to be enrolled in the New York State system. Those details will be coming forward at that time. Where will happen, that will be rolling out of those things. So it is work in progress. We will ask for people to be patient. There is a saying, it's vaccine does not save lives, vaccination does. I think you have heard of that, right? There is a hesitancy in the community. There are people who feel like it's rushed out and all those things. And CDC has provided a lot of guidance at this point. I listened to the whole weekend for their guidance. They had in terms of approval, as well as continue to do so. They will be a frequently asked question the CDC has put out on their website. One of those things, biggest concern people have is the vaccine safe. Based on what the data is, it seems like the vaccine is very safe at this point. But the CDC will continue to accept the feedback from any side effect or anything which is happening through their systems, what we call Vaccine Adverse Reaction Registry, and they are going to be, I think, in a process of unveiling an app in which people will register when they are getting vaccine from the healthcare provider, and they will get the continuous, it's like a texting that you can report that. This is a very good way to have the continuous conversation, and the role of provider will be to report to the CDC that these are the side effects which we are seeing in our patient population, and the patient himself or herself will have that empowerment to sign up for that app and will be able to directly report that. And those things will continue to be rolled out in a way the CDC will report us in whatever the quarterly or 6 monthly way that we will know that what is happening with this vaccination. They are also talking about QR code and different things. So there's a lot of work being done in the background. So safety, and safety is very important. This seems like a safe, but at the same time, we need to make sure we are vigilant and also persuade people to get vaccination when it is offered without hesitation at this point. I think a discussion with their healthcare provider based on their underlying conditions are very important, and we are there to serve our healthcare provider community alongside with them. So thank you.
Questions?
Are you aware of any vaccinations being dropped off anywhere in Onondaga County today?
Nothing confirmed yet, Andrew. I think by tomorrow, I'm confident the vaccination process will have begun.
So when you see someone in New York City getting the vaccine and 10,000 being given out in the state today and no one in Onondaga County or Central New York will benefit from that, is that frustrating?
I think it's on its way, right? So I think overall, I think it's a positive day related to, and again, if you just think about this, I mean, Dr. Gupta can reference this. From my knowledge, the fact that this process started in March and here we are in December and there is a vaccine is historic and unprecedented, and the scientists and the leaders that worked at Operation Warp Speed should be very proud of themselves. I think it's one of the most historic events that history will judge very, very well. So I'm not. I know it's on its way. If it gets here tonight, I hope they start vaccinating, and if it gets here tomorrow morning, I hope they start vaccinating.
To talk about the contact tracers a little bit, how many contact tracers do we have in Onondaga County? Do you know?
There's two things. So the investigations are you have essentially about 50 people in the health department that do this every day, and contact tracing is different. So your investigations are essentially you're doing all of the legwork and you're identifying the key information, and then you transition that to the contact tracers who then make the phone calls with that. So we use the Bloomberg team for the contact tracing right now. When you look at we've been almost 100 people on and off have been going over the last 2 weeks to Dr. Gupta's team to help beef up that investigative piece. That's a lot of people, but the schedules have been 2 days, 3 days, 1 day. Sometimes when you get somebody, if you're a senior person and you get somebody and it's their first time doing this, it takes away your efficiency. So now what we've done is, just as we've seen surges, we are going to surge even more resources where this is what these people are doing. This is their job. And at 225 individuals, and then when you look at the caseloads, that on average maybe four a day, maybe at some point they'll be able to do 5 a day. You can do the math. We'll be able to get the job done within the time period that will help us get that reinfection rate below 1%.
With the furloughed workers that you're offering to help, have you gotten any yet?
So there's a process for that. So today we spoke with the union. We let them know our intentions. In the furlough agreement, I believe there was maybe a 7-day notice clause. So we'll give that notice saying you can come back. This is what you'll be doing. Then if that employee wants to come back before the 7 days, they can. The union, I'm sure, will sign off on that. So a little bit of positive news, obviously, for those families, too.
Do you know how many you're expecting to come back, or have an idea?
I think between the voluntary and involuntary, it was in the 30s. So those folks will come back. We'll have to move more people over permanently from other departments until we get through this. And some of these employees, again, and I spoke to these employees today, some of these employees will go from your isolating and boxing in the virus, right, your investigations, and then we may need to move them over to the vaccination piece of this. We will be ready with all of our vaccination planning. So when the vaccine's here, that it's being used. And we'll put all the resources necessary to that. So right now, I mean, this is our surge. This is our response. This is the game plan that has been effective. We were overrun. Now we're not. We're going to get on top of this so that in the event you have Hanukkah now and you have Christmas coming up. In the event we see you see a leveling off around this range, then another spike, we're going to be there. Hopefully people are going to get the clue, though, related to that. I've received amazing, one of the nice things about this job is I get these, people reach out, they send letters, they send emails. I've received so many letters from families saying, I wish I didn't get together on Thanksgiving. My loved one got it. You were right for saying these things. And so let's not make the same mistakes now in Christmas. So people just need to get a grip. We're almost done with this. And if we can hunker down and learn from Halloween and Thanksgiving now. So if you didn't believe the thing in Halloween, Thanksgiving, I hope you do. I hope after the last week people get it. When I have to announce people dying, and that this is a bad spot to be. It's an even worse spot if it's somebody you know and love.
Could you just go over that a little bit more? 225, you're moving full-time into the health department to do case investigations.
Correct.
Is that on top of the 100?
So our
you
team's
announced
got to
that?
be 225. So the 50 there, you've had 50 every day doing this. Dr. Gupta's team members are also moving on and doing different components of this. But 50 dedicated employees from the health department. We're moving an additional 175 over, and this is their job. And then when we get to the next phase of the pandemic, once we flatten this curve and start to bend it, then we will move. Some of these will go back to their other duties. Some will stay, and then some will move over to the vaccination part of this process.
So effectively, that's going to roughly triple how
Correct.
many people have been doing case investigations.
Correct.
And aside from, you said you're going to bring back about 30-ish that have been furloughed if they come, and the rest are moving from other departments?
Yeah, and then we'll look at potentially 103 employees. We'll figure out what our number is. We'll look at 103 employees that were either their hours were cut in the beginning of the pandemic, or we'll look at 103 employees that might have just been working in a department. Board of Elections just had a lot of 103 employees. These are all options we have. And then again, if it comes down to it, we're going to, if we still have gaps, we'll go bring on 103 employees from the public.
You have a call at 4 o'clock, you said, with the nursing homes about vaccinations. Is that kind of a courtesy call because you don't technically oversee them? Is that just a kind of an emergency management plan
Yeah,
call?
I think what we need to do now, and again, I think there's, my experience will tell me this, Andrew, is that the federal government, when they do their job right, they don't always do that really well, is a funder. The state government is usually a regulator, and then your local government usually does the work. So I believe that's how this will play out with vaccine distribution. So part of what we need to know, and again, this will be important with hospitalizations as well. Look at our hospital numbers. Look at 30% of them coming from nursing home cases. If these folks get vaccinated, and we know a high number of these folks got vaccinated, of course an individual can opt out. This bodes well for our hospital numbers in the future. So certainly we want to make sure that these facilities have teamed up with the right pharmacy so this can happen. They've communicated well with the individuals who live in these facilities. If there's power of attorney, you've communicated with the families because this will significantly help us with hospitalizations moving forward and loss of life.
Did you see there was an eight pages worth of obituaries in Sunday's paper? Now, of course, not all of them were related to COVID, but a few of them actually addressed COVID and that their loved one had died from it. What do you have to say that speaks for the community?
Yeah, I saw those. Many of those obituaries weren't surprises to me because we knew some of those people, and we've gotten to know their families, and so that's very, very painful. Saturday was a very tough day, just overall, to have to talk about that, and the emotionally draining day, and for the community, what we need to learn from this is that this is here in a way it just hasn't been. We're all at a level of risk that we haven't been at, and those who are most vulnerable to this are at a different level of risk. And so we need to think about risk mitigation for ourselves. That's what we've been talking about, and our families, but especially our family members who have underlying conditions and who are seniors, because the virus has been brutal on these folks. So this is not where you want to be. I've talked to family members whose parents got this on a weekend, on a Saturday or a Sunday, and on a Monday or Tuesday they've lost them, and it just happened like that. And so we need to learn from this. We need to mourn with these families, but the best way we can show respect to the people that are no longer with us is to learn from their sacrifices, essentially. And that's what I think Dr. Gupta was talking about, especially as we go into the holidays here. A surge scenario higher than what we've seen with more and more hospitalizations is going to lead to people dying. It's going to lead to more economic distress, and then people may be dying in different ways. So let's avoid all of that. Let's hunker down. Let's take the holiday season off, be with your immediate pod, and that's it. And then once we all get vaccinated, you can celebrate a second holiday and bring back the elves on the shelf.
Ryan, it sounds like the review of the transitional nursing home facility that you proposed is moving along. Are you hearing positive or negative on that?
Yeah, I heard some positive today. Hopefully we'll get some news from the state, again, in short order. The plan we put forward essentially we'd be up and running tomorrow if approved, so we can start getting these 31 residents out of the hospitals into a more comfortable setting as well for them. In that, and again, that frees up 12% existing beds when you compare that to COVID beds.
So is this basically an existing facility that would just be converted to all COVID?
Correct.
On which nursing home campus?
I'm not going to tell you that answer yet. Hopefully tomorrow. Hopefully tomorrow.
But you're thinking it's that soon? It's tomorrow or the next day?
Yeah, it has to be. It's a no-brainer, and we need it. I'm getting emails from loved ones now saying talking about why their family member can't go home, they're recovered, and the same thing. So I understand why you don't want them going into a population that's not COVID, that doesn't have COVID, but we've solved the problem. It's with a great operator. The staffing we've addressed, so everything's been addressed. Hopefully we'll get the green light tomorrow.
Are we seeing flu cases in any numbers yet?
Flu, I think we had 5 a couple weeks ago. Very, very small numbers. I think.
Why are we seeing small numbers of flu but large numbers of COVID?
Do you want to touch that, Doctor? I'll let Dr. Gupta take that, not Dr. McMahon.
It's a tricky question in terms of, it's not a tricky question, but it's a tricky answer. I can give it to you. Most of it is any common cold viruses, any seasonal viruses which circulate. We are not seeing that many of this at this point. The COVID has pretty much taken over our lives in general. I don't know why we are not seeing more flu cases. Part of it is because people are taking all the appropriate precautions so they are not transmitting. SARS-CoV-2, which is the causative agent of COVID-19, is much more infectious, so that probably takes over, and they are the other ones we are able to get rid of it, so it's not transmitting from one person to another one. I think at the end of this flu season, we'll have much better idea that how many cases, and we are still in the beginning of the flu time. Usually see the cases in January, February. That was, if you look at the graph, when the New York State, puts out the Central New York, and we actually have adopted that now instead of putting our separate one, because they get the laboratory reporting from the labs. We were actually getting from the calls when the physicians were calling us. So that seems like a much more definite information. And I would be very cautious about watching for the January, February time. If we are seeing less of it, then it will be a question why we had it less flu at that time, right? One of those things, of course, will be because flu, you can do prophylactic medication if there is exposure. The other thing is people get flu shots. So even though it may not be that effective, as we are talking in 90s, the flu vaccine has been effective in, usually from 39 to 40, 50%. So despite, and people are taking all these extra measures of mask and physical distancing, staying home, so that helps in avoiding the transmission. So I think you have 2 extra measures of the medications. Antivirals are there, so they are being treated, people are treating them. And one of the questions which we will raise it are the doctors testing for flu also. So those are so I'm answering your question with the answer, and with the question further to my colleagues. I think this is something we'll have a little bit more information at the end of the flu season. It is very important to remember that.
Also, while you're there, you mentioned a problem you're seeing of people sort of going for the second opinion test after they've already tested positive once.
Right.
Are you seeing like large numbers?
No, we are seeing small numbers, but I have seen enough that it raised my concern. I just feel like, no, I think people, because sometimes we don't want to know what we have. We just feel like, oh, we have COVID positive. How can we be COVID positive? And there are instances when people can't figure it out. How could they have been exposed to? So they're not many, but they're small percentage, which we see that. So there is a question comes and they say, oh, if I get the other test. And also sometimes people question the validity of a test. Oh, this test is not good. I'm going to get the other one. So PCR, which you are getting through the drive-through, is the gold standard test at this point. And then the rapid test, which you are getting in the urgent cares with the different machines, with the PCR, that will be the second one, and the antigen will be the third one. So antigen is good for the screening purposes. If somebody has symptoms, we never recommend that person, even though somebody is negative and they have been exposed to somebody and there is a high suspicion, then we will ask that we are not going to accept that negative. Please make sure that you get the PCR test. So that is very important. One thing which I wanted to remind everyone, I think it just is when we do the contact and case investigation, we are asking people to use an app it's called Share My Contact. So we are encouraging people to use that app so that people can actually put all the contacts in there, and that directly goes to the contact tracers for the New York State, what we call PCG group with the Bloombergs. It reduces the time people are waiting for to get the contact from the contact tracer. So I just wanted to add that. I forgot to mention that.
Does that mean that the patient shares the contact information of people they believe?
Right. So let's say you are positive, and then I am interviewing you, and then, okay, Tim, I said, I'm going to send you this information. I'm going to send you a text, which is the New York State app, and you are going to receive that text. It gives you all the instructions. You can log into it and then put all the contacts, who you remember, your friends, your household contacts, you'll start with that, who you're living with. You put their name, date of birth, their email, the phone number, whatever best information you have. Friends, you may not have all the information. You may have their phone number and name, but that helps her, or where you're employed, right? All these things increase efficiency for us significantly. So we are encouraging people to use the smartphone. And I know there are a good percentage of people, especially elderly, they may not be able to use it. So we are, of course, going to do data entry ourselves. But those who can, we are asking them to do that. That will reduce the time that will reduce the time a contact tracer will contact those contacts, to put too many contacts word, into the quarantine. So thank you.
Dr. Gupta, don't go far. Over the next 48 hours, some Central New Yorkers will be having the conversation if they should be vaccinated, if it's available in a nursing home, if it's a healthcare worker available in a hospital. Put your hat on of having your own slate of patients. You're now the health commissioner, so every county resident is your patient. What kind of conversation would you have with them about what they should consider in terms of getting the vaccination?
I would strongly recommend them to get vaccinated because it is going to save their lives. Yes, there will be side effects. That's we know that. And if you look at the studies, it's unreasonable to have their expectation that they won't get any side effects. They will get side effects. Maybe some people will get more, some people will get less, but they're not getting COVID. COVID is the one which can take them to the hospital, which can infect other people, and can result in somebody's death. So there is all good sides of it. Yes, there is some side effects. That's the good, I think it's a good trade-off. So I would strongly recommend my family, my friends, my patients to get the COVID vaccination. It is, if it's offered to them, if it's available, and starting with Pfizer and then Moderna, whichever comes next, go and get it, because this is the way we are going to save our community and bring the economy back. And I will take it as soon as it's available in public, along with Ryan.
Can you give it?
Well, I will keep that part professionally to the nursing staff who is going to give it to me. I think it's important. Of course, I can give it to somebody, but I think we need to have some roles defined, and they do a fantastic job. So.
Anything else?
Ryan, you mentioned you're going to be doing 21,000 tests a week. Is that an increase?
Yeah. So each week that we can continue to get into the community, again, we're doing yellow zone testing, orange zone testing here. This week we're out in the community. When the schools slow down, we'll be out in the community much more doing that. We have to find it. You can't isolate it if you don't find it.
With more case investigators, will you be able to target like buildings, large apartment buildings, or
yeah,
workplaces?
if you look at what we could do early, and when you read up on, I keep using South Korea, but that's the example where they did this very well. They kept their economy open, meaning other public health impacts didn't impact them the way that other public health in lockdowns impacted us. They were able to, the more information they had, the quicker they could go and identify potential problems and global sources of spread, and then send out health department individuals to go figure out what is the challenge in where the infection was happening, to limit that. Those are the things you can do with the resources, we're now going all in to fight back against the surge, and if we get more resources, we'll do more, because this is how, with the virus weakening, when we start to ramp up vaccinations, it will be more effective as well for the community.
How expensive is that surge?
This is going to be, it will be expensive, but we can't let this get out of control, and that's where we just went through a budget process. I got a budget. We got some money we can spend on this in the beginning. If there was ever anything to use, look at your reserves for, it's this. But we're in the beginning of a budget year, so we don't have to worry about that right now. But this is the biggest task. We have to have this under control as we move into the next phase, and we have to work with regional partners as well, and help them where we can as well. Other questions?